Okay. Well, good evening. Um, my name is Leslie Halpern, and I am professor and section head of oral and maxillofacial surgery at the School of Dentistry. And I share the leadership of Women in Health, Medicine, and Science with my colleague, Dr. Yoshimi Anzai from Radiology in the School of Medicine. We are both extremely privileged to be part of a joint seminar with MEDiversity and WiHMS that is entitled Elevating Women in Health Professions. And this is such an exciting topic. It's a topic that has been going on for generations. And tonight's panelists will bring a very stimulating discussion and hopefully some solutions or food for thought. Before I go any further with our housekeeping and introduction of our panelists, I'm going to turn this over to Jennifer Wilson, who is Program Manager of the Office of Diversity and Equity and Inclusivity. I didn't say it in that exact order, but the EDI. And she's going to talk a few minutes about MEDiversity and what is coming down the pike. So Jen, would you please give us a clue?
Absolutely. Thank you, Dr. Halpern. So we are very excited to be having this inaugural MEDiversity Week, or as Dr. Rodriguez has pointed out, it's also Me Plus Diversity Week because diversity doesn't start without me. And we are grateful to be doing this virtually while still in the midst of a global pandemic. In just a moment, I'll go ahead and put the link to our MEDiversity webpage in the chat for everyone to access. And there you'll find more information on the mission of the week, registration for additional events that we'll have tomorrow and Friday. We have also been working with Utah Navajo Health System and are encouraging folks to donate this week to this organization to assist in their COVID relief efforts on the Navajo Nation, which has been one of the hardest hit by COVID-19. And again, that link will go in the chat. Before I hand it back to Dr. Halpern, I'd like for us to take a moment so that we can acknowledge the indigenous lands on which we all stand. We acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the enduring relationship that exists between many indigenous peoples and their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. And Dr. Halpern, I'd like to turn the time back over to you.
Thank you very much. I would also like to shout out our program manager of WiHMS, Mo Leguan, who has played a very vital part with Jen Wilson in bringing this to fruition. So thank you, Mo. So some housekeeping issues. We are all on mute, so I don't have to tell you to mute. We'll have wonderful discussions this evening, and we're probably going to have a lot of questions. So if you can please put your questions in the chat box. And we have Jen Wilson and Mo Leguan looking at those, and they're going to keep us abreast in case there are questions of interest that need to be answered besides the ones that we have chosen. And we thank all of you for sending them in because they're going to lead to some very exciting discussion. Finally, after the presentation, we're going to have a survey, and we would appreciate it if all of you would take the time to fill the survey out. That's how we get better as a team. We ask our stakeholders for their opinions, and everything helps, whether good or bad. How can we be better? How did we end up shooting it out of the park, etc. With that, let us begin. I have the privilege of introducing our first panelist, who I've shared co-directorship in WiHMS with, Dr. Amy Barrios, who is now the ex officio with WiHMS. Amy has a very exciting background in research and really has been a leader for women in that particular area. She did her BS degree at the University of Utah in chemistry. She did her PhD at MIT in Massachusetts on inorganic chemistry, and she did a postdoc at UCSF on pharmaceutical chemistry. What makes Amy quite special for us is now she is currently professor and Associate Dean of Postdoctoral Affairs at the College of Pharmacy. And this is a very important position, especially in relation to women's issues. I'd like to turn it over now to my colleague, Dr. Yoshimi Anzai, to introduce our two other panelists.
Hi, good afternoon. Hi, nice to see all of you. I hope you're doing well and this long-standing pandemics. So excited to have a MEDiversity and a WiHMS webinar. Thank you, Dr. Halpern, for introduction. I have such a great pleasure to introduce two fantastic speakers for this seminar. First is the Dr. Christina Callis-Daffin. She is the newly appointed chair of dermatology. And believe it or not, she's the probably only clinical department chair in the School of Medicine. She's been really phenomenal leader in this dermatology and the School of Medicine women leadership. The Dr. Christina Callis-Daffin is board certified in both internal medicine and dermatology, and her primary clinical focus has been comprehensive care of patients with psoriasis and other rheumatoid disease. I think one thing about Dr. Callis-Daffin is tremendous powerful women leadership. She guides all these women in the School of Medicine. So we are so grateful to have her in a panel discussion today. The other speaker is, of course, Dr. Jose Rodriguez, who is the Associate Vice President for Health, Equity, Diversity, and Inclusion at University of Utah. And Dr. Rodriguez has been such a tremendous power source for our movement of diversity, and equity, and inclusion. Dr. Rodriguez is a professor in the Department of Family and Preventive Medicine, an extensive background, and has done so much work beyond University of Utah for diversity and equity and inclusion. He has been leading the health sciences newly formed the diversity committee, and also he's a very active member for school medicine anti-racism committee. So with that, I will hand it to Dr. Halpern.
Great. Well, to start off, I'm going to give a quote. The quote came from Mentoring in Surgery, but it applies across all disciplines. Look beyond our prejudices and unsupported convictions towards full use of the gifts women bring to medicine and surgery. And I think that's a very important quote as a springboard, because one of the most prominent questions were, in order to elevate women in health professions here at the University of Utah, we have 5 wonderful health campuses. Where do we begin? Well, we begin at looking at our baseline values. So Dr. Rodriguez, Dr. Yoshimi and I took a look at the questions in relation to that, and we decided to ask you to start with, what percentage of tenure-track clinical faculty in UHealth are female and other under-recognized gender or minorities?
Well, thank you for asking that question. If we speak about UHealth as a whole, as you mentioned, there are 5 different educational units, really 6, right? The library, the College of Pharmacy, the College of Nursing, the College of Health, and then the School of Dentistry and the School of Medicine. Of those, when we're talking about faculty, the majority of the faculty in the College of Nursing and the College of Health today are women. The College of Pharmacy is very close, but in the School of Dentistry and the School of Medicine, the majority of the faculty are men. Unfortunately, other gender data we do not have yet. We're looking for ways to actually get that information, but I can't talk intelligently about that. When we talk about percentage of faculty that are women, at the School of Medicine, that's 35%. And we should recognize that that's not just MD program, that's also in the science programs, that's also in the physician's assistance program and in the public health program. And in the School of Dentistry, it's less than that. Nationwide, schools of medicine across the country, women outnumber men in the medical school student space, period. In the faculty space, men still outnumber women. We expect that to change rapidly as we have certain specialties that are majority women today. specifically OBGYN and pediatrics and family medicine. So your question is, what's the breakdown between tenure and non-tenure? Now that question is a little harder because I don't have all of the data, those data in front of me. But what I can say is this: when we're looking at the women faculty in most of the colleges outside of the colleges where there are majority women, the overwhelming majority of women are in the assistant professor stage, which in faculty terms means pre-tenure. As you move to associate and full professor, those numbers get smaller and smaller. Now, it is so important that as we have this discussion, that we recognize that women are white women and Asian women and Black women and Latinx women. There are women of color that we need to speak about almost not as a separate category, but as a subset of women. And if you go into that category of tenure, there are almost none in all of health sciences. And we should think about that for a second. We have 2 schools that are majority women in the faculty, and we still don't have women of color, very many women of color with tenure. Now, it's not zero. And I have to tell you, it's not zero, because I do know of some Latina faculty who do have tenure. But at the full professor level, there are very, very few. And when you talk about it. So I think we'll leave it at that and say, not only is this not a heartening way to start this conversation, it's also a real call to action. And it's a call to action for those people who are in those positions, the people who have tenure, the people who are leaders. How do we develop those newly minted junior faculty members to get through their junior faculty days and become tenure eligible and receive tenure? Because it doesn't really matter what we feel about it monetarily. Tenure is an important part of leadership in academic medical centers and in academic health centers. We don't have deans without tenure.
You bring up a very vital point that I feel is a wonderful segue. I don't know whether my colleague, Dr. Anzai, do you want to say anything about this? Because I think it lends credit to the next question that we will get Dr. Duffin and Dr. Barrios involved with. And that has its basis in mentorship. And I think, Dr. Rodriguez, your comments with tenure have to do again with mentors. It all begins with the mentor, especially when you're dealing with young women faculty who are going on to be the next legacy. I don't know, Yoshini, if you want to make a comment.
No, I think the number is one thing, one metric. 30% of women, that's one thing. But I think we need to look carefully at how women are succeeding in academic career, and also important that the women are in a leadership or not. I think a pure number percentage is one thing, but it's a somewhat short-sighted number. We need to look more carefully where women are distributed. And also to the point of Dr. Rodriguez, the women of color, are we able to support those women to succeed in this institution? I think that's the biggest question that I have. But please go ahead and talk to panelists about your mentorship question.
Yes, so I'm then directing it to Dr. Barrios, who is in a wonderful position, affording her the capabilities of mentoring, as well as Dr. Duffin, since dermatology is a specialty chosen by women. So I'd like their comments on this.
Sure. I think mentorship is absolutely critical. I think that the question that was spun out to us was, are there different kinds of mentorship? So there's mentorship, there's coaching, and another word there that it may be missing is sponsorship. So it's absolutely critical that we have the ability to match up our young faculty, all of our faculty really, with mentors. And mentors can come in all different flavors. There can be kind of life mentors and, you know, research mentors and clinical mentors. But then as people grow into leadership roles, as they advance, I think they also need sponsors, which are those that put them out there and say, this is, you know, maybe you will be in a succession plan. And, you know, I would like to just shout out to John Zone, who was my co-chair for 2 years. That's the ultimate sponsorship, to have somebody sit side by side in a position of leadership, and that's sponsorship.
Yeah, thank you. I agree that mentorship is absolutely critical, having a good team of role models and sponsors and advocates to work with. One of the things that I think is a great strength of WiHMS is that there are a great number of amazing women here on campus, and I know that I gained an awful lot of mentors when I came into working with WiHMS, both people who had been in the director position of WiHMS in the past, and our current mentors, our current co-directors are great mentors for me too. So I think that there's a lot of value to be found in looking outside your own area for mentors as well.
Thank you. Thank you, Amy, for your comment about the WiHMS. I completely agree with you about this mentorship and also networking opportunity that WiHMS provide. Great.
What it is. And there's some keywords here that I'm sure the audience would like to have solidified. You can be a mentor, you can be a role model, and you can be a coach to your underling. I would like each of our panelists to possibly answer, do they have a role model or a coach or a mentor in their career path? You could start with Dr. Rodriguez or Dr. Duffin or Dr. Barrios, whoever.
Ladies first.
Sure, sure. So I definitely I've had many different types of mentors. I've already mentioned Dr. Zone as being a mentor and sponsor and role model, and I also feel that this is sort of an issue really for women in leadership, is that often there are not enough women in leadership to have as role models. So I think sometimes as women don't feel like you want to be in a leadership position because you may not see yourself there because there are not other people like you in that position. That may be true of underrepresented minorities as well as women. But yes, I have several different kinds of mentors and coach. I have a coach and.
Great.
I would just add to that and my previous thought about WiHMS that I found, as I mentioned, a lot of mentors in the female community here on campus in the health sciences and across campus as well. And I found that people are very generous with their time. As Dr. Duffin said, there's not a huge number of women in upper leadership positions, but those who I've been able to meet have been really generous in being willing to sit down with me and do a little bit of coaching and kind of help me understand how they got to where they are and help me to start to think about how I might want to progress throughout the next stages of my career. So I go back to Dr. Rodriguez's initial comments that it's so important that we get more women and more people of color, more people with just more diverse backgrounds in senior leadership here on campus. But those who are here have been really generous about sharing their time. And I think that is something that is a strength of Utah and of our collegial and collaborative environment here on campus.
Great.
Dr. Rodriguez, do you have a comment about your mentor or role model that you had in your experience?
As a matter of fact, I do. I am in family medicine, and the overwhelming majority of my mentors and sponsors have been women. I talk about some of the mentors I had in my previous institution across the country. One in particular was my mentor in residency and still is a mentor today. And that's Dr. Townsend. Another one is Dr. Southpaw, who really have been influential in shaping this academic career. I went to medical school to see patients. I had no idea that I could be an academic physician. And these two women, very powerful, very smart, and very strategic helped me actually carve a path into this world. And I'm very grateful for that. I've had sponsors and who are men as well, principally Dr. Okuyemi, who is my chair. But I will say that this is an important piece of getting to any level of success. And I've really been a beneficiary from people who've sacrificed really time that they could have been spending on their own careers to try and build mine.
Wonderful. Thank you so much. I'm going to move on to a different question. Obviously, we can talk about mentorship a whole day. This is such an important topic. By the way, so this is more town hall style. So those questions were actually sent it to all these people who register for the meeting. So first of all, thank you so much for sending all this question. So those questions are chosen from those the registration information. And I think hopefully this will create a more candid, open dialogue between you all to leadership and University of Utah Health. So the second question is around this women in leadership. This is also the discussion in a town hall sort of discussion with Dr. Good, but why there not enough women in a leadership position at the University of Utah Health, not just the school of medicine, but University of Utah Health? What are the barriers that exist? And how do we ensure that women will be able to represent a certain leadership at these organizations? So I might start with Christina, Dr. Duffin, WOK, and then Dr. Rodriguez and Dr. Barrio. Thank you. It's muted.
I'm sorry, yeah. I am not in, it's because I started to type. I didn't want you to hear my clicks. So I'm not sure I could really answer why. I think that it's probably pretty clear that there are many variables that affect why there are not women in senior leadership positions. I think it's very multifactorial. I think that to change it in terms of the barriers, right? There are many different barriers. Those could range from there could be all different variables, right? That we are not being intentional enough about making sure that we create opportunities and make sure that there are positions open for women in leadership. So I think that we have to be very intentional about this. And actually, this is Dr. Rodriguez's word, right? We have to have intention about how we're going to change equities in, gender equity or minority equity. We can't just sit back and say, well, we're going to try to do this. We're going to have to take action to change it. We're going to have to make sure that our search committees are represented and diverse. We have to make sure that we address bias in how we create search committees, how we instruct our search committees to look for clients. We're doing this with our residency, where we instruct our search committee for our residents to say, we don't want to look at just board scores or grades. We need to look at path traveled, and we need to have bias training to really address this. So yeah, that's the start of an answer. Maybe we can send it to Dr. Rodriguez.
So one question before Dr. Rodriguez answered, there was a question to the chat boxes from the panel. So if women outnumber men in OBGYN, pediatric and family medicine, why are all the chairs are men? I don't know, that's a good question, but you're a family medicine, so Dr. Rodriguez, would you be able to take that question from the participants?
Okay, that's a fantastic question. And the unfortunate truth is that is not unique to the University of Utah School of Medicine. That's a near universal phenomena in specialties that are majority women, that the chairs are men. Now, I'm not going to pretend to go to know all the reasons for that, but I will say one thing, that hasn't been addressed. And, you know, we talk about bias. I think we have to really talk about what ends up being a systemic problem, okay? So when you look at your applicant pool for a position, or for many positions, let's say you want a residency and you have 5 positions that are available. When you look at your applicant pool, really your applicant pool should be reflected in who you choose, right? So in family medicine residencies, the majority of the applicants are women, the majority of the residents are women. As we go further up the chain to higher positions, that has not changed. And I think that there's an important thing that we have to recognize here, and that is that sexism is something that is not always intentional, but it is almost always there.
Mhm.
And so what we have to do is make sure that we are looking at the applicants and the positions in a way that will help us to make decisions in an equitable fashion. I fully expect most of family medicine leaders across the country to be women in the next 10 years. All right, right now the president of the American Academy of Family Physicians is a woman. Right now the president of the Society of Teachers of Family Medicine is a woman. And that the Society of Teachers of Family Medicine, women have been the leaders for almost my entire professional life. So I think we have to recognize the role of sexism and how it sneaks into our lives. And then we have to actually take action against it and make sure that when we're writing letters for women for positions of power, that we don't use terms that are, I hate to use this word, but it's almost sexualizing. It's almost stereotyping words. Whereas we write a letter for a man, he's strong, he's smart, he knows what he's doing. And we write a letter for a woman and we say she's nurturing and kind. All right, those things are true. But if that's all we say, it doesn't come off the same way for the people who are reading these letters. And so we have to be very careful with that. But, you know, we have to be thoughtful. Like Dr. Duffin said, there's no organic diversity. All diversity, gender diversity for women of all races and ethnicities is deliberate and intentional. So we have to make the decision to do it and then do it. At some time in the future, it'll be all changed. But I don't really want to wait for a future. I kind of want to see it happen now.
Thank you. Dr. Barrio, what do you do? What does things happening to promote a woman in a leadership in a college of pharmacy?
Yeah, well, one thing I guess I would add to what our previous panelists have mentioned, or to piggyback on that to give an example, one philosophy that I've heard senior leadership in my college and outside of my college espouse, I guess, is that they like to see someone prove themselves on a committee or in some other capacity. I know I don't like this very things before they're able to promote them to a leadership position. And there's a lot of problems with that philosophy in and of itself. But then we think about these biases that are coming into play, and what I see happening to the women in my area and other areas across campus are that we tend to get assigned or asked to contribute to the committees that are more the housekeeping committees, the more service-oriented, nurturing kind of committees, rather than the more power-driven committees that would get you the visibility that you would need to then prove yourself in the way that those senior men want to see you proven. And so one of the things that I am trying to suggest for my junior female colleagues and male colleagues too is to be strategic and intentional about which committees they're willing to serve on, and to try, it's a challenge because sometimes we want to follow our passion, and if we love mentoring, we're going to want to be on that mentoring committee, but also to make sure that we're on the committees that are going to get us the visibility that we need in order to be able to take that next step.
And I would love to add on one thing to that, which is that we also, as leaders, are responsible to make sure we don't make decisions for our young women faculty. So there is, I think what's probably felt is, oh, I'm protecting them or I'm helping them by not asking them to serve on a committee, when in fact you didn't ask them if they want to. Oh, they have a young family. I don't think that they're going to have the time to do this, when in fact you need to ask them. And that's something that no leader should do, is assume that that person doesn't want to serve on that committee. That would give them advancement. That would give them visibility.
Yeah, I would just like to add to what Dr. Duggan said. I can tell you that women in surgery really suffer from this. They can't be too aggressive and they can't not be too aggressive. And whenever a woman surgeon is introduced, never introduce a woman surgeon as, this is a great woman surgeon. This is not just a great woman surgeon. This is a great surgeon. This is a surgeon who has taken wonderful care of their patients that is represented by the specialty that they're in. But I must say, getting back to my famous buzzword of mentoring, I think the role of all of us who are in leadership is to be mentors and instill that in our young women faculty. You know, women faculty, as Dr. Rodriguez says, and as Dr. Anzai and Dr. Barrios added, are always given these child care committee positions, right? Never health policy, never which way are we going in the curriculum, things like that. So I think it really is left up to many of us who are females, who are mentors, to make the difference. You know, what's happening in general surgery now, and I can tell you, is that they're giving part-time residency positions, so women and men can be more involved in interpersonal relationships and family relationships. So there is a perfect example on how the tide is turning. So it's something for us to think about, and we have such a large amount of women on the campus to do so.
If I could add just one thing, one of the things, I don't know, this seems a little more positive to me, so we'll see if it seems positive to you guys too, but one of the things that I found as I started thinking seriously about wanting to try leadership positions and see what kind of opportunities there might be for me outside of my department and my college, when I started speaking up and talking to people about these kinds of opportunities and just asking what kinds of paths they took, people were very receptive. And once they realized that I was interested, a lot of people were very happy to recommend me for different things and to point out different opportunities to me. And so I think that that's something that we might need to think about. It's something I didn't feel comfortable doing until I was a tenured faculty member. There's a question in the questions here about, should this start before faculty? And yes, of course it should. So the earlier you can start both advocating for yourself and advocating for those around you, I think that can help as well.
That's great, because one of the questions from attendee was, shouldn't start before faculty? Giving opportunity for women, people, you think, well, the woman has many things to do at home, but rather start from trainee, even medical students, giving opportunity to involve for the research project or something. We have to be, as Dr. Rodriguez said, very intentionally able to provide opportunity for women and underrepresented minorities. So thank you, Dr. Bayo, for the perfect question to the answer that I posted. Dr. Hoffman, do you want to go to the next questions?
Okay, it really was the mentoring, and I think that we've been covering that. I think that is interwoven. I can jump to the women in the workforce. So one of the questions that one of our attendees who registered said, how is leadership preparing to deal with the impact of women's productivity during the COVID pandemic? And that has affected every woman and male who are healthcare providers. So I would like to ask our panelists that if they've noticed some innovative ways of multitasking during this COVID pandemic.
Well, I would like to just shout out to the Child Care Task Force group. This was very quickly identified. Angie Fagerlin and many others jumped right in and said, this is, if we don't help with tutoring and childcare, we won't be able to address this problem. So I think at the university level, that was a tremendous collaborative effort to make sure there was a variety of resources, so that if not just faculty but staff needed help to get alternative childcare arrangements, tutoring, et cetera, that was done. And we've also taken this back to the department level to say, are there other things we have to do for this? And a lot of it is also just flexibility and understanding, and making sure that we're asking people, are you okay? Or what kind of support do you need? So reaching out to them to ask them how we can help.
Great. Dr. Barrios?
Yeah, I think that this probably varies a little bit from what part of campus you're on. I would just remind us that we're not all clinicians. Some of us are researchers and in other fields as well. And so I know there's a few things that have been happening on campus. The Vice President for Research is now studying the grant submissions that have come out over the last 6 months. And I'm sure we've all heard that some people are just really cranking out grant submissions and paper submissions. And then if you're someone like me with 3 reasonably small children, that's not me. I've not been cranking anything out. I've just been trying to survive. And so they're trying to do some studies to see whether these are different groups have been disproportionately affected by this, and trying to find ways to address these problems. Dr. Duff had mentioned one approach by the child care, but one of the other things that's happened, of course, is that everyone's able to ask for a year extension on your tenure clock if they need it, or their review clock.
Yes.
I think other campuses have been more proactive than we have in some ways. I know other campuses have just given that extra year automatically to everyone rather than making you request it. And so that's something that lowers the barrier a little bit. And we might think about doing things like that here. I know in addition to the childcare benefits and being able to share those around, people have been able to share their sick leave, and there's been approaches there. An attendee in the Q&A is asking who's conducting these studies with the VPR. So it's Andy Wyer's group, but I think that it's mostly Diane Pataki and her group that's doing this. So I'm sure they're going to come out with this data fairly soon. They've been pretty good about sharing their data. I just wanted to point out a couple of things that have just happened fairly recently that I think are possibly of general interest. So the Vice President for Research's office is offering grant writing support for those who are having trouble meeting their grant writing goals because of family care issues or other unexpected issues during this time. So you can check out their website if you are interested in that. And then the University of Utah Health, this is a reasonably new program and it's not helpful today, but it might be helpful fairly soon. They're providing small grants or small amounts of funding if you need to go to a conference, for example, and you can't go without bringing your child and you need to arrange some kind of childcare. So there are a variety of programs that the university is trying to put into place to hopefully help make things a little bit easier for those of us who have childcare or dependent care issues. Yeah, I think just one other thought, Sarah, then I'll pass it on to Dr. Rodriguez. I think that one of the things we're going to need to look to in the future is that these gaps and these challenges that are happening this year and probably into much of next year are not going to go away. So when we're hiring faculty in 2 or 3 or 4 or 5 years, we're going to need to still remember and still be intentional about checking the pathway and understanding where these people are coming from, because a good number of really outstanding candidates might have a pretty big gap in their CVs during this time period. And so I think we're going to need to be mindful about this and keep this in our minds as we're trying to hire and promote and think about that so that we can attract the most diverse pool of people that we can.
Wonderful.
Absolutely. I just wanted to pay attention to those people asking questions about childcare. Dr. Duffin put in a pulse. This is really the huge childcare task force led by Dr. Angie Fager and also Amy Locke. I was a part of this wonderful group of committee, but really made a huge effort to make it available for many people, both men and women. Childcare is not just a women's issue. It's actually affected both men and women. So there are the resources available in the Pulse site. So for those people who did not know where to look for, please go to the site. And also we are switching to chronic sort of a long-term childcare solution beyond the COVID. I think even though COVID-19 may be around for another year, but I think beyond that, we need to look for childcare resources. I think institutions are start thinking about long-term childcare resources. Again, Dr. Angie Fagging, Amy Locke, and many other people across the health sciences, including staff, not just the faculty, to address the issue. So thank you so much for bringing up, and thank you, Christina, for sharing that site.
And I wanted to add, there's been some other comments made to the panelists that this is a really stressful time for our women, both clinicians and researchers, our staff and faculty alike, that especially when the landscape continues to change, you're switching from online to in-person to online. It's a really difficult time. And you mentioned Amy Locke, the Resiliency Center has been a tremendous resource for the for our folks here, for staff and faculty alike. There's a really interesting part of the website for childcare called UMatch, and so you can actually go into that, and they can help match up your needs with your situation, with resources. So if you're feeling very frustrated and need more help, there's another person out there who can help you make that match. So not only do you have to get this sorted out, you have to solve the problem too, right? So this will help solve that problem, I think.
Yes.
Thank you, Wendy Hobson Lord, the Tribal Scholarship from this Office of ABP and Health Sciences Education. This was really led by Angie Fagging, but people who have to travel with small children, there's a travel fund available. So thank you so much for mentioning that. Go ahead.
Oh, thank you. I think that it's really important to kind of think about what this COVID time really does mean, right? And I think that one of the things that I like to say is that COVID is a time for kindness and a time for compassion. Where I agree with Dr. Barrios that people should be given more time in their tenure clock to get the work done. What I'd really like to see is to see the societal good that people are doing by actually taking care of children because they can't send them to school, have some sort of academic value. Now that's a radical idea. I'm not sure it'll ever take place, but I think there's societal good that's being done all over the place that the university benefits from, but that we don't give any credit for. Mm-hmm. And so, and in the chat there talks about it's not just small kids, it's dependents, it's parents. I have colleagues who are taking care of older siblings and younger siblings. And so there's all of these things that are societal. There's societal benefits. We benefit as a community. How can we give that value?
Absolutely.
Absolutely. What we don't talk about much that we always need to go back to too, I think Dr. Duffin mentioned it slightly, has to do with the stress on us as healthcare providers. I mean, we're that wall, we're the first responder, but we need an outlet to release the stress that all of us are under. And that is something I think we've spoken about on a previous webinar, but we need to always keep that in mind and be advocates for each other.
I agree. I also know a good chemist who can help us get stuff.
Thank you. This was a great discussion. I want to just save a time for this next question, which is women and salary equity. So one of the questions from attendee came out and said the wage gap between men and women is a recurring topic in general conversation and in media. However, most of the time, this is based on comparing apples and oranges, such as all men with all women. Are we aware of any more accurate statistics where wages are compared with each profession, such as faculty having some rank or department or situation where all the variables are adequately controlled? So I would go to send that question to Dr. Duffin, who's a clinical department chair.
Yeah, so salary equity you're right. It's yet another multifactorial, complicated question. As the question that was asked points out, there are a lot of variables that you need to look at, and there have been some studies out there. And thank you for some of the references that were provided by this group. But a salary equity study from 2016 that looked at this and did collect additional variables. It wasn't all across all specialties. In fact, dermatology was left out of this one, but did, after looking at this, adjusting for the variables that they could adjust for, there were still inequities between men and women that couldn't be explained from the study, from the data that they did. So the challenge is to explain what those variables are, right? What is causing that? So that's our charge. We need to do that. I think as leaders, we need to look at our salary models to see if there are some built-in biases that are creating that. Certain incentive plans, for example, could create biases. And then just the last comment to say is that COVID is going to make this worse, right? So as especially some of the childcare and tutoring responsibilities, homeschooling responsibilities are divided, there's likely going to be more of that falling on women. I know in our own department, this has been the case. So an N of a few, but it is the case that oftentimes they bear more of the responsibility there, and that creates less time in the clinic, less salary opportunity.
Yes, thank you. So the other question related to salary gap, including, will there be an audit to determine pay equity between men and women? Or also diverse and non-diverse, meaning perhaps the difference in salary based on the races. Dr. Rodriguez, would you like to answer that? And also, yes, regarding a particular race, ethnicity, salary gap.
So when we're talking about salary gaps, right now our School of Medicine really is kind of leading the effort here with the Salary Equity Committee.
Mm-hmm.
And I think that what happens is when the salaries are analyzed by a certain algorithm and something is seen to not, and a gap is identified, for example, then the Salary Equity Committee points that out to the leaders of that department, unit, division, and they work together to fix it. Now, right now, it is focused on the gender gap. And that is where the focus needs to be right now. Because as Dr. Duffin said, there are unexplainable, when you do it and you compare apples to apples, same rank, same time in rank, same amount of publications, same amount of patients seen, on, there is a pay gap. And when the pay gap, all of the other factors have been looked at, the answer is sexism. And when the answer is sexism, then we have to work immediately to undo it. And we don't have to be kicking ourselves, but we have to act. And this is an important thing. And this is the kind of stuff that I've learned from one of my mentors, Dr. Hobson-Rohr, who is an excellent example of, she's the Associate Vice President for Education and Health Sciences. Yet she has taught our office many things about gender equity, about how we can be better advocates for the women in our institution. And I'm grateful that she's here and that she's a part of our institution. We learn from each other.
So one question. Thank you so much, Dr. Rodriguez. I invited last minute Dr. Catherine Degree from School of Medicine, who actually led Salary Equity Committee at the School of Medicine since 2005. And we were able to unmute her. So she's able to answer some of the questions related to salary equity between men and women, or perhaps a different racial ethnicity. Dr. Degree, would you be able to speak up to the participant?
Yeah, thank you. Thanks for this opportunity. I think it's really important. This has been a wonderful discussion. We have been working, Peter Jensen, Chair of Pathology, and I have co-chaired the Salary Equity Committee since 2005. And this was started in response to what was perceived to be several problems with gender equity. And this was one of the areas that was looked at. This committee meets twice a year. We review all the salaries in the School of Medicine, both research faculty, clinical faculty, tenured, non-tenured, and we look for any equity issue. Each department, we look at each department. If the committee identifies something that seems to be a little off, we definitely meet with the chairs. Sometimes that meeting results in an adjustment. Sometimes, however, there are many reasons for people to have different salaries in a department based on roles, based on, when Dr. Duffin covered this very well, opportunities and roles and what the person, men or women, want in their career. How do they want to do their career? We haven't really looked at diversity, like race, salaries by race. We've really focused on gender, but I'm going to definitely bring this to our committee when we meet again, which will be pretty soon. And I would encourage people to always look at the WiHMS because they publish salaries per specialty, per level, and they give salaries for men and women and in the specialties, et cetera, et cetera. So you should be able to look at that WiHMS report. And Cynthia Best, who is really amazing in the Mission-Based Management Office, MBM office, is incredible at helping anybody understand their salaries if they are having some problems. But we want you to know that not just a group efforts, but a group salary review, but it's actually individual. Everybody in every department gets sort of reviewed. I mean, most of the time it's pretty equal, and if there are inequities, then we try to explore them.
Mm-hmm.
Dr. Degree, there's a question for you from an attendee. Can a faculty member reach salary equity committee members directly to analyze or investigate pay gaps within their division?
What I would recommend that you go to Cynthia Best to start. Go there to start with, because she may have more information, and she would bring to the committee any issues that need to be settled.
Great. I would like to ask a personal question because, you know, we have members, of course, of the other colleges besides the School of Medicine. I myself from the School of Dentistry. Do the salaries across the campuses ever get discussed within a main committee, or is it left up to the individual school and exclusive to them?
And that I can't answer because I only know about the School of Medicine.
Okay, thank you.
Thank you, Dr. Degree. At a health systems level, it is being addressed by individual schools. But you bring up a great point, Dr. Halpern. Maybe it's time for us to actually take and look at all these data in aggregate.
Mm-hmm. Thank you.
Because there's disparities that will become evident, and there will be places where it will be shown that we're doing this well, and we'll be able to spotlight them and help others to see the way to do salary equity correctly.
Yeah, definitely not every college or unit does it in as systematic or regular or transparent a way as the School of Medicine. So that's definitely something that other non-School of Medicine units need to work on.
Mm-hmm. Thank you.
Any other question related to salary equity? I know this is a very recurring hot topics every time we have a webinar, but please type your question that we want to be able to address. Again, this is a dialogue between you all to WiHMS and MEDiversity. Thank you so much. Right. So the other question, if we can move on. Thank you so much, Dr. Degree. Thank you so much for participating in the last minute's call. Thank you. About related to women of color. So there's a few questions. One question is, what percentage of women faculty in health sciences are women of color? Do we have that benchmark or dashboard or data? What's the pipeline development like for BIPOC, Black, Indigenous people of color? So I'm gonna start with perhaps Christina Duffin, and then Dr. Barrio, and of course, Dr. Rodriguez.
So I don't think I don't have a number off the top of my head, so I'm going to defer that question, that part of it. I know in my own department that we do not have any Black women faculty. We have a deficit in BIPOC faculty in general relative to the population in Utah, and this is known, and we're addressing this. And the question is about the pipeline. What we did in our department a few years ago is said, what are we doing about this, right? And I think Dr. Rodriguez was very much in charge of this question. What are you going to address this inequity? And we looked at, well, where are faculty recruits coming from? And they're coming from our residency, right? Most of our faculty, and told over 50% of our faculty came from our residency or were returning to Utah. And so we said, well, we have to be intentional. And if that's going to continue to be the case, then we need to recruit a diverse set of residents. Now, dermatology doesn't have an inequity in women. 60% of dermatology trainees are women, but relative to that, our department is still about 40% women. So we said we have to recruit at the residency level. And even when we try to do that, we can see that the pipeline is limited. There are very few Black women students coming out of medical school, so the pool is very small. So we want to enrich it, but we have to start, as I think somebody said in the chat, well before people get to faculty level, right? We have to be starting at the high school level, right, in the undergraduate level to create that pipeline. And I think this is true across all specialties, and many departments are making very intentional efforts to go out and recruit. So, and maybe Dr. Rodriguez, you could answer the first question that I deferred. So.
Yes, I'll answer it, but right now I can't remember it. It's about percentages of women of color across health sciences, correct?
Mm-hmm, yes.
Okay, so of those 35% of the School of Medicine that are women, there is a much smaller percent that are women of color. If we look at Black and Latino as a group together, there's about 70 altogether in that faculty of 1,772. Of that group, the majority are men, but it's very close to equal. So we're talking about in just the Black and Latinx community, we're not talking about more than 35 women in the School of Medicine. When we go to the other schools, those numbers go way down because the faculties are so much smaller, to the point that there are some schools or colleges on health sciences that don't have any women of color that are faculty. There are others that have no men of color that are faculty. The one group that I don't have great data memorized for is the very diverse Asian group, because we have a large percentage of our faculty across health sciences that are Asian. And so I would say that if I was to guess, I still think that the majority of the faculty and those from that people of color group are men as well.
Mm-hmm. Dr. Barrio, do you have any comment about recruiting more pipeline of men and women of underrepresented minority via BIPOC.
Yeah, sure. I know we're running out of time, but just really quickly, I'll mention that from the research basic science side of things, the bioscience graduate programs have done a really nice job of increasing representation in our graduate pool, going from single digits to over 30% in the last few years. And as in Office of Postdoctoral Affairs, where I'm working, we are now trying to continue that pipeline and develop a pipeline for underrepresented groups to continue on as postdocs, because as Dr. Duffin said, a lot of our faculty ranks maybe not come directly from our University of Utah postdocs, but they come from the postdoc pool across the country. And the more we can diversify that, the more we'll have a better pool of diverse candidates to choose from.
I would like to add something to what Dr. Barrios just said, because I know at the School of Dentistry, we've developed a new recruiting strategy that we're sending our admissions committee members out into different communities. And we're trying to get people excited about going into dentistry and going into health from rural communities, for instance, from communities where you would never imagine that there would be an interest in health. So I think developing a pipeline that could be more transparent across UHealth would be a wonderful thing to think about in the future.
Absolutely. Thank you, Mauricio. I think he typed it in that chat box. Says, fiscal year 2019 at a school of medicine. This is just a school of medicine data. Women of color, 7 Black, 24 Latinx, and 103 Asian, and 1 not answering.
Native American.
So definitely we have a long way to get there. But I think, again, Dr. Rodriguez said, it has to be very intentional. It does not happen organic. We always have to keep in mind that when you have opportunities to recruit someone, then we have to always think diverse thought, diverse pool, talent actually makes us much more cohesive groups of organizations. So I think it's really great point to at least know where we are so that we need to get some directions. Thank you so much. We are running out of time, but Dr. Halpern, would you like to do any comment? Or anybody, any panelists, do you have any last comment that would you like to state? Dr. Rodriguez, would you like to say something at the end?
I'm always willing to talk. I will say just one thing is that I'm here surrounded by powerful leaders in health sciences who happen to be women. And I would like to add my voice of allyship and my voice of using whatever privilege I have by virtue of being a man to actually create more leaders like you. So thank you for coming.
Wonderful. Dr. Barrios, something, final comments?
Oh boy, I don't know if I have any brilliant final comments. I will just maybe echo what Dr. Rodriguez just said, that I'm very pleased and privileged to have these allies in this work and to be able to participate in this work. And I think I've seen good changes in parts of campus in the last little while. I think that we're on the right trajectory, and I think that there is a lot of potential for us to really make some strides in the near future.
Great.
I would like to echo again, gratitude, especially for Dr. Rodriguez, who has will come on any phone call. He's giving us language. We just kicked off our diversity task force in our department, and very much appreciate the support of all of you as we move forward. And I think it's very exciting.
Great.
So I like to just, Dr. Halpern, do you have any comment?
Just that I wish that we can have another hour with our panelists. Yeah. There's so much more thought, but I think that we're on the right track. There is a beginning, and there was a lot of suggestions of which way we can go. And
Yeah.
WIMS is what it's all about in terms of what we have to offer. And those of you who don't know much about WIMS, you can go to our webpage, and we'll have that on the chat. And Dr. Anzai did a phenomenal job as a co-director, and it's onward and upward for us.
Thank you so much. This was really fantastic, that those town hall style discussion Q&A, the real live answer to many of the people in the campus asking, I think that really the best way to connect each other and really represent this MEDiversity week. So, and I want to just thank Jen Wilson. Fabulous job, Jen. I mean, fantastic job to organize this webinar and town hall style. Thank you so much. And also Mauricio, who is the program coordinator, Mauricio Langan. Really wonderful to have him. So thank you, Mo. We can't do anything without you. So thank you so much for organizing everything. And with that, all this exciting evening, I'm sure everybody go home with a family member, but please stay safe. The COVID is still pandemics. Wash your hands, wear a mask, please. And hopefully you'll check in other MEDiversity event this week. We still have a few more days to go. So thank you so much and a good evening.